in terms of what we've done to limit, exposure and contagion, we could do several webinars on. But in broad strokes, we're implementing as much as possible the science-based guidance, and so we have implemented as much as possible physical distancing between not only patients and other patients, but patients and staff where that's appropriate. We're using protective equipment in accordance with all of the CDC guidance to directly kind of address the telehealth portion of this. Early on during the beginning stages of the pandemic, when there was a lot of uncertainty, we made a decision very early that this was an unknown that we really needed to adapt to quickly, and so we transitioned heavily our staff to a telehealth model, and that presented, as you can imagine, some challenges, but it was also an opportunity to learn really how to do this and how to do it effectively. And we're not just, sort of doing it, we're also doing it, and then we're studying it, and we're looking at data from our outcomes to say, what can we effectively manage via a telehealth platform versus what are the things where that in-person hands-on management is really critical and necessary. And so we're navigating that as we go along and learning as we go along, and that's been really helpful, because I think looking to the future, the telehealth idea and the telehealth platform, this really galvanized the efforts, and it gave us opportunity to reach beyond where we had been historically. So the idea of doing in-home training with a caregiver in the person's actual home setting, that alone is really something that could potentially be huge, to be able to reach geographically beyond an area where it would have otherwise been hard because of rural concerns. So those are there. In terms of how we're accomplishing that, I'm certainly not the one accomplishing it, but I've seen the sausage being made, and I've witnessed some of these treatment sessions, and it really boils down to the creativity that's inherent to some of the therapeutic disciplines, and they are doing some really amazing things with that platform. And some of the feedback that we've had from patients has been very positive about the experience, and we know from the outcomes data that people are still getting better. So it is a viable platform for some things. There are certainly some things that just don't lend themselves that way, and so what we've been doing is trying to balance that risk-benefit analysis and really hone in on an individualized treatment plan for each individual patient. So that's probably more than you wanted to hear, but.
No, I think I'd make just one added comment to that, which is, with the telehealth, that genie's out of the bottle, and she is not going back in. But one thing that attention to is there's an indication that among those who are treating, because it certainly has its value, right? Telehealth certainly has its value.